Hey friends, it's Peggy Hall here from thehealthyamerican.org. This is a message for homeowners associations and for those who live in communities where there is a homeowners association or an HOA. And in particular, I would like to speak to the idea of opening or closing the facilities that the HOA oversees. For example, a swimming pool. There might also be locker rooms. There might be a communal area, there might be a barbecue, there might be other activities and recreation facilities. I want to speak about that, and I want to very clearly explain and educate the difference between guidance and a law. And the good news is, for you HOA members and those on the board and those attorneys that might be actually giving legal counsel, I want to help you understand legally the definition of guidance. Guidance is like a suggestion. It is not something that needs to be followed under the threat of law or penalty. Just like you have been operating your HOA safely all of these years, you have had an eye to keep things safe, in good repair, you've decided on the hours and who can use them. You've already been doing all that. Why do you want to give your power away to a required set of guidelines? I really don't understand that, and maybe you don't understand that. So that's what I'm here to do. I'm going to share my screen. Here we go. And I would like to share with you, first of all, the actual guidance. Remember, that is not a law, and this comes, I'm speaking for the state of California, and you can apply this to your area as well. Let's look at what is coming from the California Department of Public Health. Those in other areas, you can look at what's coming from your state Department of Public Health. It very clearly states that this is guidance. Guidance is not an order, it is not a law, it is not an ordinance, it is not a rule, and it is not a regulation. All right, you board members who are paying attorneys to counsel you, you can run that by them. And if they are competent, they will acknowledge that guidance is a suggestion. It is not a law. It is not an order. It is not an ordinance. It is not a rule, and it is not a regulation. This is in California from July 2nd. I'm going to scroll ahead to look at where it speaks about swimming pools. But right here, let's see again that this document provides guidance for campgrounds, RV parks, and outdoor recreation areas. All right, guidance is not a law. There is no law that requires you to follow this guidance. And if you are worried about liability, I will talk about that in just one moment. So I'm going to scroll. If this makes you dizzy, you can close your eyes for a moment. I'm going to scroll all the way down to where it speaks about swimming pools, because that is an area of concern from many individuals that I hear from. So here we go. I'm there. The considerations, now that's an interesting word also. A consideration is not a law, and your legal counsel will tell you that. There is no liability associated with you not following these considerations. You cannot be fined, you cannot get a citation, you cannot have the health department write you up any violation for a consideration. Please understand this clearly. You and your HOA may not be written up or cited or fined for not following a consideration or a guideline or guidance. Are we clear? Okay, so because this is just a consideration and guidance, you do not even need to follow it. Here's one, for example, that says the saunas, steam rooms, and hot tubs should remain closed. Well, there is no law that requires you to close these venues. Here's another one. For outdoor pools, the face coverings must be worn. No, there is no law requiring that. Well, Peggy, what about the word must? This is being used in a document called guidance. There is no law. There is no penalty. In fact, let's do this. I'm going to go all the way to the end of the guidance. And as you can see, there is no penalty, there is no law that is cited. And if you run this by your legal counsel for your homeowners association, if they are competent, they will agree that this is not anything that can be enforced by law, because you would need to have the code, the regulation that you are breaking. And it would say, for example, in California, the California Health and Safety Code, and there would be a number, and then there would be a penal code, and a penal code is the penalty for breaking that regulation. And as you can see, there is nothing there. Now you're going to say, well, what about liability? We don't want to be sued if someone catches this disease in our facility. That's our main concern, is we want everybody to be safe. Well, let's talk about that. Have you signed a new agreement with your insurance company? Is there a new section in the insurance agreement you have with your insurance company that states that you could be liable for someone catching a disease in a location? I will answer that question for you, because the answer is no. Your insurance contract likely has remained the same throughout all of this situation, and I'm going to show you exactly why. This is in California, and likely it is the same in your state. Let's take a look at the screen, and I'm going to show you here in the law in California. If you fear liability, your fear is unfounded. You are no more liable for an infectious disease. In fact, you are less liable for an infectious disease occurring in your facility than you are of a broken leg, a slip and fall, a hitting your head, something falling, having an accident. You are more likely to be sued for someone having an accident because of these things you're putting into place, like closing the showers and the restrooms, which makes no sense, not having chairs available. What about elderly people that are coming? How do they get up and off the ground, for example? That's extremely hazardous. There is no special liability for any infectious disease. Run this by your legal counsel, and a competent attorney will confirm that it's the exact opposite. So let's take a look at this, shall we? This is from California, the Health and Safety Code. I have a link to it if you would like to click through. And this is a statute. That actually is a law. A statute, as your legal advisor will tell you, a statute is a law that was created through a legislative process. So there was a bill introduced into the state legislature. There was debate, there was a vote, and it got passed through, and it was signed into law. Now, regulations are a type of law that also go through a regulatory process called a lawmaking process. And those regulations are intended for the agencies and the departments to fulfill the carrying out of the statutory law. Don't worry if this is confusing for you. I've studied it for some time, and I would be happy to advise you, your HOA board, and the attorney that you're working with if they are unclear as to how the legal system works. So there is a statute that makes it a crime for a person to intentionally transmit an infectious disease. Here is the code from California. First of all, a defendant is guilty of intentional transmission of an infectious or communicable disease. And this word is extremely important. Intentional transmission. That means they wanted to make you sick. First of all, the defendant knows that he or she or a third party is afflicted with this disease. Are you with me? So someone at your HOA would need to know that they already have some infectious communicable disease. That's step number one. Step number two, that individual would act with specific intent to transmit or cause a third party to transmit that disease to another person. Are you with me? They would need to know that they have it, and they would intentionally, on purpose, set out with a specific intent to transmit that disease to someone else. The person or the afflicted party would have to engage in conduct that poses a substantial risk of transmission. All right? And finally, that person or the third party would transmit the infectious disease. This is an actual code in the California law that is all about infectious disease. How can it be proved that a member of your community went to a communal area like a barbecue or an outdoor area or the swimming pool or the locker room? How could it ever be proven that that individual got infected with an infectious disease there? How do we know they didn't get it last week at work, because it can take several days before the symptoms show? You can see that this is ridiculous. There is no special liability associated with this COVID situation that you can be liable for. You, as the HOA, cannot be sued or cannot successfully be sued by someone bringing a case saying that they received this infectious disease at your location. You do not get a disease from a location. Are you clear with me? Okay, you can also share this with your legal counsel so that they can understand the law, that no one catches a disease from a place. It is impossible. The law does not recognize this. The law does not recognize an individual catching an infectious disease from a location. Not from a restaurant, not from a grocery store, not from a hair salon, not from a nail salon, not from a bar, not from a swimming pool, not from a shower, not from a park. You do not catch an infectious disease from a location. So to summarize, I have clearly demonstrated and given you written evidence that there is no law and there is no mandate and there is no state mandate regarding the operation of your private facilities. As the HOA board and as the attorney who counsels them, you always are maintaining an area that is safe, that is run with the intention of serving the people who live in your community, who are paying the dues, who have been adults and making responsible decisions for all these years leading up to it. There is nothing different now. There is no law. There is no penalty. There are guidelines that you are not compelled to follow. Further, these guidelines, if you want to err on the side of safety, these guidelines, if anything, make the conditions more hazardous. So now, instead of having a functioning restroom or having pool chairs and amenities, now you've got individuals that have to sit on the ground, that may have difficulty getting up. Now you are setting yourself up for a slip and fall lawsuit, or someone that is not able to use the restroom and may have some type of physical or medical ailment. This is what you need to worry about. Reducing the hours of the swimming pool or other facilities because you want it to be safe, but now because of the limited hours, you have more people when you wanted there to be more spread out. It doesn't make sense. So that's what I'm here to do, is to clear these things up for you. I am available for you to contact if you would like me to go over this again, but it's very clear. There is no law. There is no state mandate. You are not liable for anyone catching a disease at a location because you only catch it from a person. And by shortening the hours or reducing the available facilities, you actually are doing the opposite of what you state that you want to do, which is to keep your community safe. I hope you'll take this under consideration. What you are doing is actually not lawful, and I know that you don't want to have legal action from your residents who have been extremely patient and who now are going to possibly seek legal remedy for this situation. Thank you.